This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.
Bringing you Africa's Health in Focus from the Health Broadcasting Service HBS Radio Live channel, a special documentary focusing on healthcare in Africa. This is a program designed to examine the healthcare provision and the maintenance of the general health of all Africans. We will from time to time focus on different nations in Africa. Welcome to today's segment. Africa is the world's second largest and second most populous continent, next to Asia. African continent is a home to a vast range of national identities and regional cultures. At about 30.3 million square kilometers, including adjacent islands, Africa covers 6% of Earth's total surface area and 20% of its land area. With 1.3 billion people as of 2018, it accounts for about 16% of the world's human population. Africa's population suffers from more than a fair share of non-communicable diseases like cancer, chronic lung diseases such as asthma, malaria, diabetes, heart disease and hypertension. Communicable diseases such as viral infections, tuberculosis, Ebola hemorrhagic fever, measles, HIV AIDS, pertussis, influenza, and typhoid fever are rampant. This situation is complicated by the weaknesses of most of the healthcare systems across the continent. Healthcare is as to be expected not cheap in Africa, and the system does not adequately support the poor, the vulnerable nor the disadvantaged. Medical interventions, which can help lessen the burden of diseases, or alleviate pain, and prolong lives are no commonplace. Where few exist, coverage and quality are low, and consequentially are either of little effect, or altogether ineffective due to systemic accountability and responsibility failure. It is common knowledge that the major problem confronting Africa today is weak health system. In terms of health care, governments face several challenges, including lack of or poor management of funds and poor infrastructure. This is compounded by epidemics, poverty and the brain drain of home-trained doctors moving abroad in search of better working environments and conditions. For majority of the health professionals, higher wages and better standard of living rank very low in the reasons for migrating. Most parts of Africa practice two-tier healthcare system. Some better equipped health facilities are often reserved for the more affluent, whilst the commonplace poorly equipped facilities are for the grassroots and the not so affluent. In today's segment, we shall be focusing on Zambia. Zambia offers universal healthcare to all its citizens, which by the Western standards is extremely basic, because it is very much underfunded. Zambia's healthcare system, which is largely decentralized, is divided into three levels: hospitals, health centers, and health posts. Hospitals are separated into primary, otherwise called district hospitals, secondary, otherwise known as provincial hospitals, and tertiary hospitals, otherwise called central hospitals. Healthcare costs are charged for at the point of delivery, which is at the primary healthcare level. Zambia's population comprises of a sizable number of migrants. Most migrants, and all too often, wealthy Zambians, prefer to patronize the private healthcare system, and with much of the international community and commerce based around Lusaka, it is not surprising that Lusaka is where the best private hospitals are located. Those relocating to live in mining community compounds may find that there are medical facilities on site, provided by their employers. There is no doubt that there are inequalities in Zambia's public health system, although health services are largely financed from public tax, donor community grants, and direct payments by households. Those with the greatest need for health services are unable to afford the costs and therefore do not receive their fair share from the healthcare system. Ultimately, such are left out of the universal health coverage. It should be borne in mind that inequalities in healthcare utilization are widespread in majority of African countries. Focusing on the impact of communicable and non-communicable diseases on the Zambian population, studies show that there are 5 major health problems in Zambia: HIV/AIDS, neonatal disorders, lower respiratory infections, tuberculosis, diarrheal diseases, ischemic heart disease, malaria, and stroke. The high burden of illness among the Zambian population, shortages of health professionals, widespread poverty, relatively poor distribution of resources among the grassroots in the rural areas, lack of medical schools altogether make it difficult for an effective local and national healthcare coverage. Malaria continues to be a major problem to most of Africa, Zambia included. Despite the general success rates of vaccination programs for polio and some childhood diseases, and some other diseases like HIV/AIDS, malaria, tuberculosis, acute respiratory infections, and diarrheal diseases to a lesser degree generally in Africa, Zambia included, diseases continue to be the reasons behind high mortality rates in Africa. The impact of infectious diseases can be traced according to economic performance of African countries, showing that 34 out of 53 countries are classified as low-income economies. The disease burden is, however, more devastating since it affects all components of human development, including income, health, and education, and life expectancy. The impact of infectious diseases on African countries is no longer a crisis only for the healthcare sector, but presents a challenge to all sectors, including economy. It has the potential to reverse those gains made in human development in the last few years, unfortunately. Before we round up today's segment, we should lay some foundation for our next episode, so please subscribe to our channel so you can continue this very important discussion with us. Majority of Africans, most especially the grassroots poor and in need, and to a lesser degree, those in the middle income bracket, are forced to rely on the underfunded public health facilities, with a small minority being able to access well-funded, quality private healthcare. In 2001, according to records, African nations came together and agreed to allocate 15% of their budgets to healthcare. However, evidence shows that the following challenges continue to weigh against any major positive moves: inadequate human resources, poor resource allocation to health, poor maintenance of healthcare system infrastructure, and lack of political will. In our next episode, we will be featuring another African country as we continue our focus on the health of Africans. Until next time, please stay with us. There are more engaging thoughts we will from time to time bring to you. Remember to subscribe to our channel. And until next time, it's bye for now.
This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service.